Hello, and welcome once again to the Mind series, a series where we're talking about autism. This will be the second segment of our talk on autism. Last segment we talked about the identification and recognition of kids with autism to get a sense of what they look like. And today's episode we're going to be talking about what do you do for a child with autism? Once it's been identified, how do we approach the care of that child? And to back up a little bit to understand what might work as far as treatments, first thing to mention is what may cause autism. And that's a very hot topic, and there's a lot of debate as far as that goes, and there's a lot of strong feelings and to some extent limited evidence as to the things that really cause it. We certainly know there's a genetic portion of kids who may get autism, may develop that diagnosis. And some kids are probably very largely genetic. There's been almost 100 genes associated with the development of autism, but not a lot of kids have the same genes, and a lot of kids with autism look very different. So it's likely that a lot of things are going to be looking different because there are different things within the autism spectrum, and different genes will be involved. Along with that, there's growing recognition that there's likely going to be some environmental factors or triggers which may increase the risk of developing autism. And that's where the biggest debate is. What kind of chemical things in their environment or other things that may shape or cause a child who has a predilection for developing autism to in fact develop autism. A lot of the treatments that are aimed or geared towards children with autism may work well for one and not for another. And part of that's because if you look at a child who has Asperger's syndrome and has no speech impairment, then speech therapy obviously isn't going to work. And that'd be kind of an easy example. Some kids are going to have a tremendous social impairment, and some kids are going to be more stuck or rigid. Anytime you try to formulate a treatment plan, you try to gear it towards the individual. I know for myself as a parent, when our son was diagnosed with autism, we struggled to find any kind of treatment, really. Once the diagnosis was made, we realized that within the county, apart from some of the services the school had to offer, and potentially some very, very basic medical options that were available, there really were no options. And so that's what we set about to say, what can we do to help not just our son with autism, but the other families in our vicinity who have the same struggle. I mean, it's a burden to get the diagnosis. It's a greater burden to find that once you have the diagnosis, you have no tools. You have no place to go really to get help for your child. And so that's the need we're trying to fulfill at Mind Matters, is to try to establish that next link, is not just diagnose, but to make that connection and find out what works for that child. So we try not to limit ourselves to any one specific thing, because you have to recognize each child with autism. They say there's a saying, they say, you've seen one child with autism, you've seen one child with autism. I mean, there's very, very unique characteristics of each child, just like anything, and so you gear it towards that individual. One initial things you do if you identify a child with autism, apart from the impact of the family, which can be tremendous initially, they have to kind of recover from it. They may go through periods of denial and may retreat and to some extent actually just run away sometimes from the diagnosis. But the earlier that it's identified and earlier that you start treatment, it helps both the child as their development and also helps the family dynamic develop. So I'd actually like to have Karina talk a little bit about, once you've identified a child early on, what kind of things can you offer behaviorally for them?
Well, a child with autism typically needs a lot of structure in their environment, so they need to have some predictability at school and at home. So one of the first things I do is talk to the parents about how have you structured your home environment? Is there an understanding of what expectations are set in the morning and when they return from school and in the evening and before bed? Oftentimes it's helpful for kids to have a lot of visual information, and so oftentimes what I'll do is create a visual schedule for the family or help them, assist them in making their own visual schedule. And a visual schedule, basically what that is, it's a list of pictures down a column, and those pictures indicate each task that child's going to be asked to do. So that can be really helpful at home, it can be helpful at school, and each picture would represent the academic subject that they're going to and what activity is going to be coming next, like recess or lunch. And so oftentimes that can be really helpful. Those pictures are called icons, or there's also something called PECS. And PECS stands for Picture Exchange Communication System. And so oftentimes with kids who are not very verbal, they can use these pictures to communicate what they need. And so they might have a board where there's a list of pictures and they'll point to what they need. So if they're thirsty, they might point to the picture of the cup of water. And so pictures can be very helpful. Also, something that's helpful is helping parents to identify what the function of the behavior is. So oftentimes, parents don't understand that a child is banging their head against the wall because they need something. You know, what's the function of that behavior? Or a child might be screaming and tantruming, not to be a bad kid, but because they really are maybe in pain. Maybe there's a seam in their sock that's rubbing them the wrong way, and the parents don't understand that that's the function of the behavior. So oftentimes I'll try to help parents in identifying, well, why is that meltdown happening? And try to correct that problem. So
I think as a parent, I recognize that one of the greatest gifts that you can give a parent who's struggling with a child with autism is that level of understanding. Because I know we as parents, oftentimes we would see the behavior in our son and not know why it was there. Why is he being so obstinate? Why is he being so defiant? What's he so upset about? And so you really have no idea what you're responding to, so your response is usually wrong. It's inappropriate. It doesn't work. So it doesn't give you anything. So as you work with parents, oftentimes what you can do is help them identify those triggers, those things that really set them off, and say, okay, think about where it's coming from. You have to kind of think autism and say, okay, whenever this happens, usually it's something that triggers it, and you can usually back up and say, if there was a change in schedule. If you're using a PEC system or something similar, and you say, this is going to follow this, we're going to do lunch, and then we're going to go to the park, and from there we're going to go to grandma's house. If you change that order on them, and they become very upset, then you say, oh, okay, I get it. And so at least it makes you respond with a little bit more patience to say, oh, I understand where it comes from. It's going to take a little time to explain it to him, help him kind of unwind his frontal lobe that's all excited up here, and then help them adapt to the change, which we know is difficult for them. So that's really valuable as far as identifying that. There's also something called applied behavioral analysis. Can you tell us about that?
So oftentimes when you've identified the function, why they're behaving that way, you can hire, or sometimes regional centers will provide services where a behavior specialist will come into the home and actually work with the child in reducing the amount of the behavior, so the frequency, they're trying to make it less frequent. If it's a maladaptive behavior that's not working for the kid or the family, or they're going to try to increase behaviors that are really successful in the home. And so that behavior specialist can work with the families to help develop a system that rewards good behaviors and helps to extinguish behaviors that aren't effective in the home. And so applied behavioral analysis is a research-based program, and it is one of the most effective treatments in correcting behaviors that are maladaptive.
When a parent receives a diagnosis of autism, usually they reel. It's very hard to hear that because it is dreadful. It's just a dreadful diagnosis to get. And usually they go from there to becoming very overwhelmed with the amount of information they need to try to learn, their attempts to get resources, and just the emotional impact of having a child that you know may never be normal. And so that's why I want to have Susan weigh in and just kind of explain to us what she does with a parent or a family that's been given the diagnosis of autism.
So one of the things I was thinking about as they were talking that I really like about our clinic, because I always think about a certain kid or a certain family that's come in, is that when you're providing a family with resources, so I think of one young man that came in, he was 14, and immediately he was assessed by Dr. Thompson. His family felt support. You know, they still felt a little skeptical, but they felt support and a little bit hopeful. And then he was referred to Karina and put into a social thinking group. So again, they're feeling less alone, more support. The son is being given tools, and they can begin to relax a little bit. The home is stabilizing. You know, with a small child, I liked, you know, when you can give a small child a way to communicate, like PECS, then the frustration, the anxiety, the rage, the blowing out, the oppositional behavior decreases, which helps parents to be able to sit back and take a breather and to begin to turn attention to themselves and how they can take care of themselves and begin to focus on their relationship with their spouse and their relationship with their children. So often families come in sort of this shock mode, and you know, just we're their last hope often. And so anyway, back to my story. So the 14-year-old comes in, he's with Karina in a social thinking group. He's excelling in school, so he happened to be an Asperger's diagnosis where he was, you know, top of his class. But there was a lot of anxiety, obsessive compulsive behaviors, and the dad was just in the middle of what I would almost call his grief, but denial, trying to get his son to succeed in ways that he had succeeded as a child. So, you know, in this case, it might have been athletics, if I'm remembering correctly. But with some kids, it might be academics. You know, you might have a lower functioning Asperger's or autistic client. And what parents have to come to terms with is, you know, they're not going to excel academically. Whatever it is, you know, often what I find is that the mom is in the trenches and doing the next thing, getting them to school, you know, making the PECs, taking them to their athletic events, or trying to get them involved in some kind of social life. Dads often, stereotypical, but the ones I see often are the ones that go to work all day, come home, and there's their son or daughter, but I'll use son in this case, being, you know, being autistic. So think autism, you know, is the best way, because what usually we do is we don't think autism. We think me, you know, act like you're 42 and normal or whatever. And if we're projecting that, if a parent is projecting that onto any child, but especially an autistic child, we're headed for trouble. You know, we're headed for trouble. So usually for me with a family, after we've worked as a clinic, worked as a team to stabilize the family, I would begin to work with the parents to come to terms with the diagnosis, because I think their stages of grief are really apropos. You know, there's the denial and the anger and the, frustration and the grief, the depression, and then there's the surrender, then there's the acceptance. And it keeps going. It's not like one moment you come to terms with the fact your child is autistic and you float off into the sunset. You know, it's a process. It's a continual process that parents have to monitor themselves and remember. And oftentimes we don't remember till we're in the middle of some kind of unfortunate comment to our child. But acceptance of parents is helping them accept themselves and accept their children is where I start.
Something I find valuable when I work with parents is recognizing where we came from was that oftentimes you're given so many possible options and so many things to do that sometimes the parents exhaust themselves trying to go down 7 paths at once. And that's where we can be very helpful in being able to kind of prioritize things for them and say, okay, I think the first thing you ought to try is some social thinking here. I think you ought to see Susan just for some support for the family. Because again, it doesn't just affect that individual or the parents, it really impacts the whole family, because autism in a household can really consume the household and can really be a detriment to the rest of the relationships. It's certainly very hard on a marriage. Because you come home and autism's there, and it interferes with your relationships. So one of those things is try to pace things and try to narrow the focus and prioritize things for people. Medically speaking, there's not really a specific medication for autism. And like I said before, there's a lot of children with autism who have different features. They may be a bit obsessive, they may have anxiety, they may in fact be depressed. They may have gut or bowel disorders, which a lot of kids with autism do. So sometimes you have to focus on the symptoms that they have and then try to address that. There are some medications that can be helpful. A lot of kids with autism have ADHD features, and you can treat them with ADHD medications, attention deficit hyperactivity disorder medications, so you can help with their focus and attention. Sometimes if they are very, very obsessive or compulsive, you can use medications which might help with a person with OCD or obsessive compulsive disorder to stop them from being so fixated on things. And then sometimes using things to help with their digestive system. A lot of kids with autism have very irregular bowel habits with diarrhea or constipation or these particularly large poops. They're these huge poops. And in fact, I've had parents come in, my favorite story is they'll come in with an aerial view of a poop. They'll stand up on a chair and take a picture into the toilet to show how big this giant poop is, because it's very impressive. And I look at that and I go, oh, I've seen that before, so I'm not impressed at all. So, but that's something that's very characteristic of them. And so then you say, okay, that's something we're going to address. So sometimes there's some supplements and treatments that work for the bowel dysfunction. And in fact, sometimes that changes their behavior. Sometimes some of their stress or anxiety or acting out can be because of the constipation or pain or cramping, and potentially the possibility that that actually affects brain function too, that things aren't being digested, processed, or delivered into the body normally. So if you change the way the gut functions, it delivers things to the brain differently, and you can in fact see changes that way. Along the same lines, some kids may in fact be sensitive to certain foods. They may have food allergies, and kids with autism are frequently thought to have a sensitivity to gluten, which is wheat protein, or casein, which is milk protein. But again, it's not a universal thing. It's not like all kids with autism have a sensitivity to that. But there certainly are some kids who clearly seem to benefit from that kind of a dietary change. And especially if they have that kind of a history of having a bowel problem, that's where it's something worth looking at. So sometimes you head down that road. If they have an allergy history, look for food allergies. So you try to let it point you in the direction that you see when you see it clinically. Specifically medications. Otherwise, there's some things that are just used to help calm kids down. Some kids become so distressed and so stuck and rage so easily because they become so distressed, they can't manage to function in their environment, wherever it is. They can't function at home, they can't function in school. And so sometimes medications are necessary just to decrease that intensity of reactions and intensity of emotion that goes on. Because truly then otherwise they can't function. Without that, they could be institutionalized. One of the things that's really valuable, and I mentioned that in the last segment, is that kids who have autism can't maintain relationships. They don't know how to make friends. They don't do well with other kids, and they really don't know why. And parents are not really good about knowing how to change that. We can teach kids manners, including kids with autism. You can teach them to look at somebody. You can teach them to hold a door for somebody. But you can't teach them how to relate to somebody just by telling them to do it. They have to understand the mechanics, the foundation of why that happens. So I'm going to have Corinne talk a little bit about the social thinking groups that we do.
So the social thinking groups that we offer at Mind Matters are based on the Michelle Garcia Winner curriculum from the Center for Social Thinking in San Jose. It's called Think Social, and basically what we're trying to do is teach manners, but then take it a step further so that they're understanding why that's expected of them. Oftentimes, typical kids will be able to look you in the eye and say good morning and understand why that's expected, because it's polite, because it shows the person you're happy to see them. A child with autism will look at you in the eye and say good morning and have no idea why that's important. And so we like to take what's called a social cognitive approach to teaching social thinking, social skills, because we're teaching them cognitively why it's important, the reason behind the manners. And so at Mind Matters, what we do is we meet with kids in small groups, typically from 3 to 6 kids, depending on their behavior and level of functioning. We start at age 3, and we go all the way up actually to adults. Adults can come in for individual sessions. We also have a small group that meets, that's a social group of adults. We work in an apartment setting, a home setting, and so they're able to prepare a meal together and to engage in some activity together. And there's someone to facilitate that, to make sure that, they're, through their interactions, understanding how their behavior is impacting the people in the group. And teaching communication skills, teaching them what to expect in social situations and what might happen in certain social situations so that they can kind of predict things. And it's just a good way to practice so that when they go out into the real world, they have an experience that they can go back to and say, oh yeah, I did this in group, and I'm going to practice this at home, or I'm going to practice this with my friends when they come over this weekend. And so it's just a really great way to be able to get people with autism thinking more about how their behavior affects those around them and what those around them are thinking about life and their environment.
Can you give us an example, perhaps from this week, of a skill that you were trying to teach a group of kids?
Sure. So right now I have 2 preschool groups, and in the preschool group, what we're usually focusing on a lot of the time is something that Dr. Thompson referred to in our last episode on autism, which is joint attention. And so oftentimes we'll play a game where we all have to be focusing on the same game. And it might be Johnny's turn, and so we all have to watch Johnny do his part. And so we talk about that everybody needs to be in the group. And the concept we introduce is keeping your body in the group and keeping your brain in the group. Because if it's Johnny's turn and Sarah is over here, playing with my computer, then her body's not a part of the group and she's not paying attention to what we all should be paying attention to. So that's an example of what I might teach a preschooler. With elementary school kids or school-age kids, oftentimes what I'm teaching is how to be able to check in with others in terms of what others are thinking or feeling about you. And so oftentimes somebody might share something in group, and I'll look at one of their peers and say, how do you think he's feeling about that? And I'll have a feelings chart, and he'll say, oh, I think Johnny's feeling sad about what happened today at school. Well, what makes you think that he would feel sad about that? And it's just, again, trying to get their wheels turning in terms of how Johnny might be feeling or what he might be thinking. Also, what we do is trying to predict others' plans in the group. And so somebody might be about to do something, and I'll say, oh, let's watch Johnny right now. Can anyone guess what he's about to do? I think I know. And it's just another way of getting them to tune into each other, stepping outside of their own world and participating in a social event. We also do a lot of outings, and that typically with my high schoolers, we will go out and have a coffee or have a meal together, go hang out at the park, and we become social detectives out in the neighborhood where we're observing people crossing the street, or we're observing these people getting ready for an activity and trying to guess, what are they about to do? What are they thinking? How do they know each other? And so that can be a really fun way to learn social skills also. Yeah.
One of those things I notice from working with Mitch so often is that he doesn't seem to understand what other people are thinking, and sometimes you get into situations where you have to cue him in because he can be very bold. He may walk up to somebody who has an obvious physical deformity, which he's fascinated by, and he'll just ask him directly about it, where anybody else in the room would say, oh, don't mention that thing. I mean, they're missing a leg. Let's not talk about the missing leg. And he'll walk right up, touch the stump, ask him about the missing leg. And to some extent, it can be very endearing to the person because it's obvious they're missing a leg, nobody wants to talk about it. But this kid walks right up, he feels perfectly comfortable doing that. So in some ways, you can look at it and say, well, that's actually kind of a blessing or gift that he can do that. In other ways, you say, you know, there may be times you don't want to do that. Like you're walking up to the guy that looks kind of like a deranged drug addict who's fishing by Lake Alpine, and you say, that may not be somebody you want to go talk to right now, because he'll walk very boldly, walk right up to him and talk to him, and where the rest of us go, I don't know, I'm getting a sense that may not be somebody who I want to talk to. So for safety issues, sometimes you have to kind of tell them to try to guess what's going on with that person, and maybe that's not a safe place to go. Dietary changes, oftentimes kids with autism have very narrow food choices. And sometimes you have to try to expand or add new foods, and sometimes that can be very tricky because they get very stuck on things they want to do, and that can affect their nutrition. Sometimes because of that, then you have to add nutritional supplements or elements they may be needing. In addition, some supplements show that they may show improvements as far as brain function goes over time. Essential fatty acids being one, which is fish oil, and that's been used in a lot of kids with autism. A lot of kids with autism have very disturbed sleeps. And so sometimes supplements such as melatonin can help them with sleep. Kids with autism are famous for getting up in the middle of the night, our son being one. He may go to bed at 9 o'clock and get up at 1 o'clock because he's hungry. And nobody else would notice they're hungry at 1 o'clock in the morning when they're sleeping. But kids with autism, they just wake up, walk downstairs, they're hungry all of a sudden. Same sort of things for like hungry and tired and anything else. They seem to notice these things all of a sudden. So you try to get them to a normal sleep pattern, and it can be very exhausting for a parent if their child's getting up at 1 o'clock, 6 o'clock, 4 o'clock. They don't have that normal sleep cycle, a lot of kids do. Not to neglect adults, but adults oftentimes have or identify with Asperger's or autism late in life. And so sometimes for them it's a real struggle because they're already kind of down the road. And I know that's something that Susan's worked with adults with autism, and it's kind of an interesting dynamic, so I'll have her talk about that.
So what I find with adults is that they often come to me and they come to me and they're traumatized. So they're isolating, they don't have a lot of friends, they are anxious and worried and feeling pretty depressed and defeated, not because so much of their autism diagnosis, but because of what has happened to them in their life, both at school and in the world, as a result of that. So what I tend to treat is the dual diagnosis. So what I tend to work on is the anxiety, the depression, the trauma. So I do two things, and the other thing that I love about our clinic is that we work collaboratively. So the social skills is very, very important in being able to obtain friends. So I really like if they're working with Karina at the same time they're working with me. So, but what we tend to do is I use a thing called EMDR, which is eye movement desensitization reprocessing, and it can be relaxing. It can be like mindfulness or a relaxation exercise. They call it resource installation. And what I have done, and I'll tell my favorite story before we're done. One time, a person with autism had a lot of anxiety currently in his current job and was having panic attacks, so much so that, oh dear. Anyway, what happened was with EMDR, I gave him, he holds a machine and he rolls back to a time when he felt that way before, and oftentimes it can be, say, at an amusement park or in a mall where there's a lot of external stimulation. So he was holding onto my machine, remembering the trauma and having the anxiety, and all of a sudden he looked down at his chest and he said, "Susan, it's gone. I don't feel that way anymore," which of course inspires me to continue to do this work, and our time is almost up.
Well, obviously we're running out of time, and there's still a lot of things I would have liked to touch on. There's a lot of things we'd like to do, and perhaps down the road we'll be able to do that. Thanks for joining us.